Good afternoon, everyone, and thank you for joining us today for Amplify Your Voice, Control Your Care. My name is Gwen Cooper, and I am the CEO of Accessia Health, and we're thrilled that you've taken some time out of your day to join us to hear an incredible speaker talk about maximizing your provider visit. We'll get to introductions in just a minute, but I wanted to let you know a little bit more about Accessia Health. As you know, we pioneered the patient's assistance model, and we would love for you to visit our website at accessiahealth.org. There you will learn about all the programs and services that we offer for patients. Our primary focus is to maximize opportunities for patients to have access to the healthcare they need, which is why we have launched this program, Amplify Your Voice, Control Your Care, because the most important thing is to know that patients are empowered to understand their healthcare, ask the right questions, and obviously maximize potential to take advantage of every provider visit. So of course, we have to do the legalese stuff and do our disclaimer. So if we can go to the next slide. The title of our webinar today is maximizing, no, you're fine. Maximizing your provider visit. And just 1 second, I'm going to introduce Dr. Naveen Sikka. But first, I have to do that disclaimer. Accessia Health webinars, events, and conferences are intended to provide information to the public. The views and opinions expressed by any speakers or other third parties are not necessarily those of Accessia Health. In addition, the presentation of any material or information by a third party regarding any specific opinion, commercial, product, process, or service by trade name, trademark, manufacturer, or otherwise does not constitute or imply Accessia Health's endorsement or recommendation of such opinions, processes, service items, or organization. Any such material or information presented by a third party in any format at an Accessia Health event without limitation is for informational purposes only. And I challenge each of you to memorize that. So without further ado, I would love to introduce our speaker today. Dr. Naveen Sikka has been practicing in the field of allergy immunology since 2008. After completing his internal medicine and allergy immunology training at the prestigious Henry Ford Hospital in Detroit, Michigan, he has worked in the field of allergy, asthma, and immunology for 14 years. Dr. Sikka's expertise covers all areas of allergies and immunology, but he specializes in nasal and eye allergies, asthma, sinusitis, hives, angioedema, chronic coughing, eczema, primary immune deficiency, and allergies to foods and medications. In his daily practice, Dr. Sikka is dedicated to teaching patients about their allergies so they are better prepared to stay healthy. He incorporates evidence-based medicine to provide the latest up-to-date techniques such as allergy immunotherapy, biologic therapy, and oral immunotherapy. Dr. Sikka has treated thousands of patients and is committed to providing the best personalized allergy care to the community. He currently practices in McKinney, Texas, which is a suburb of the Dallas-Fort Worth area. And I have to say, not only am I thrilled that you have given us of your time today to talk about maximizing your provider visit, but in addition to my role at Accessia Health, I mentioned to you that I sit on the board for the American Lung Association. So this topic is very near and dear to my heart. And Dr. Sikka has already said, as he gives his presentation, if we come up with ideas and questions and things we just got to know, that he's willing to let us interrupt to say, wait a second, tell us more about that. So without further ado, I will turn it over to you, and thank you for being here today.
Thank you, Gwen. I appreciate the opportunity to speak to the organization and the fellow attendees. Happy to discuss all things allergy and immunology or anything medical if that does arise. So yes, please ask as many questions as you guys can think of. So, we want to make sure that when we are having an encounter with a medical professional, whether it's a medical doctor or a staff from the medical office, that we want to gauge how comfortable do you feel with your provider currently. So there's a polling question here that we'd like to ask the audience. how comfortable are you speaking to your provider currently? Is it not comfortable at all, slightly comfortable, moderately comfortable, very comfortable, or extremely comfortable? Go ahead and click on your votes now. Okay. And let's see here. So we have some varied answers here. It's good to see that nobody is not at all comfortable, and that's really nice to see. Yeah, and it seems like kind of most are in the middle, where the majority feel like they're moderately to very comfortable. And that's good. We want to actually kind of course, aim for the highest possible comfort. The goal here is to make sure that your most intimate secrets that are your personal health are given to somebody who can understand your situation and also give you recommendations or advice that is unique to your situation. And it's a goal of ours, as physicians or medical professionals, to be that crutch or that expert that you need for your care. So let's move on to the next slide here. So today's goal for the talk is kind of more of a generic kind of discussion. We want to kind of just discuss, what is a medical doctor versus physician extenders, because there's definitely a difference there in training. We all want to just also highlight why we have office visits in the first place. Why are they important? We want to discuss the responsibilities that the medical office has to you as a patient. And then, of course, what are the responsibilities that you have as a patient to maximize your health goals? And then, of course, we want to highlight that communication is, of course, the most vital function of any visit with a medical clinic or office. So the term medical provider has kind of been utilized a lot in the recent past, and there's a variety of different types of medical providers that are in the community. We kind of start off with the one that's the most classic example, which is known as a medical doctor. These can be either medical doctors with the MD certification, which is one type of training, and we'll go into that here in a bit more detail in the future slides. A DO, which is known as a doctor of osteopathy, and that's another type of medical doctor with a little slightly different certification. And then the medical extenders, which are the nurse practitioners or NPs, or the physician's assistants or the PAs. So we kind of highlighted doctor of medicine, and then which is the MD certification, the DO, which is the doctor of osteopathy or osteopathic medicine, the nurse practitioner, and then the physician's assistant. So here's another polling question. When selecting a provider, do you review the credentials or the experience before selection? Okay. So again, kind of right in the middle there, some say never, some say seldom, others have said sometimes, and there's one person that does it almost always. So I always like to highlight the differences in these certifications, because it's important to know who you're seeing in the office so you understand their training as well as their background. We'll start off with the MD first, or the doctor of medicine. The schooling requirements, it starts off with 4 years of undergraduate education. Then there's 4 years of medical school. Then there's 3 to 8 years of postgraduate or on-the-job training. We call it an internship or residency, but it's kind of basically an apprenticeship where their trainees are under the supervision of experienced medical doctors that are watching them work on the job in usually a hospital or clinic setting. So the internship, which is what's classified as the first year of training after medical school, is basically just the very first year of on-the-job training once they've graduated from medical school. And then the residency is the subsequent years of training that is required to kind of focus on the core training of the field of choice that that particular doctor has decided to pursue. This can vary. The classic examples are internal medicine, general surgery. There are others, for example, dermatology, neurology, ophthalmology. So every field that you're probably familiar with or have heard of before has a certain set of skills or core training that is required to become certified as a professional in that particular field of choice. And then one more thing that also can be done after the initial training when they get certified in their general core practice, whether it's internal medicine or surgery, is that they can go on to what's known as a fellowship. And a fellowship is another subsequent few years of specialized training where they become experts in one focus of disease. For example, I'll give myself as an example. My internship and residency was with internal medicine, which is the general adult medicine. And then my fellowship was in allergy and immunology, where I became a specialist in allergy disorders. So you can quite see it's quite a lengthy course of schooling as well as training before you can become certified as a medical doctor. With the Doctor of Osteopathic Medicine, they're actually quite similar in the way they go to school. It's actually almost exactly the same. 4 years of undergraduate education, 4 years of medical school, but here they also learn a little bit of a specialized focus, which is known as osteopathy, which is a unique subset of skills that helps understand body mechanics and kind of the physical body's positioning, physical therapy needs and mobility needs that are a bit more in detail than something that maybe a medical doctor on the MD side will not be trained to learn. And then they also have to follow the same rules of postgraduate training, where they have to do the internship, the residency, and then they can also choose a fellowship if they like. Not everybody goes into fellowship. I should probably highlight that. After you finish a residency, you can become you're a certified physician. You can practice in that field. You don't have to do a fellowship to become specialized. That is not a necessity, but it's an option if the particular physician would like to pursue that level of training. Moving on to nurse practitioners, this is also known as an advanced practice registered nurse, or APRN for short. Their education requirements, they require a bachelor's degree, which takes about 4 years to complete. And then they have to do a master's degree, which is another 2 to 3 years of school. And then they have a possible residency, not mandatory, as in the case of medical doctors or doctors of osteopathy, where they are required to do a residency before they can practice. An APRN does not have to do one, although there is an option which can last between 6 to 12 months. And that's, again, specialized in one area of medicine. And then physician's assistants is the final category of the physician extenders, where they can also evaluate and treat patients for medical issues. And their educational requirements are at least 2 years of college in the basic sciences, and they must have a bachelor's degree. Well, most of them do. They don't have to, but most of them will. And then they go to PA school for 3 years, so about 5 years total. And then again, residency, if they're interested in pursuing one. Not every PA is pursuing that residency because it's not mandatory again, but it can last between 12 to 18 months depending on the field of choice. So you can see that, just kind of highlighting the differences in the level of training with the MDs and the DOs. It's a bit more extensive. The hours that are put in can vary, but most MDs and DOs will spend about 14,000 hours training to become a certified physician. And then with PAs and NPs, although they have good schooling, the post-schooling training is more on-the-job training at their job site where they will get their first job. And since residency is not mandatory, they kind of have to learn under the ropes of whoever hires them in that initial instance. And they may not have as many hours of training as compared to the DO or the MD trainees. So moving on here now to what we call the healthcare delivery or the types of healthcare delivery. These are basically the types of visits that you will potentially have an option to have when you see a medical provider. There are different models here. The classic example is an outpatient model where you see a physician or NP or PA in an outpatient practice. There's inpatient care, which is in the hospital care. Urgent care, which is usually also known as after hours care, where you're not sick enough to go to the hospital or the emergency room, but your clinic that you normally visit is closed for the day or it's the weekend. Then there's an urgent care option. And then emergency care, which is the precursor to inpatient care in case there's something more aggressive or sinister that an urgent care facility cannot handle. And then, of course, there's telehealth, which is kind of a newer model of care that has been implemented in the past few years because of COVID, and another useful resource for healthcare delivery. So here's another polling question. We wanted to ask the audience here, which services do you prefer to use the most, or which ones do you use the most in your current situation? Okay, so kind of what I would expect to see, with the majority of us split our time with with outpatient care or telehealth in the current situation. And of course, there's a small percentage that use urgent care. We don't want to see a lot of inpatient care, emergency care. Of course, those are hopefully rare needs for our audience. And, we have those as a resource if we need it, but thankfully not a common need for most. So moving on to kind of healthcare delivery again, we kind of talk about the models of healthcare. The traditional model takes insurance. I'm sure most people are aware of that model. This is basically typical insurance costs. Here, just to kind of highlight the office schedule, usually the medical team is under a tighter schedule just because of the nature of reimbursement and the way insurance models work. A specialist will typically follow this model. I follow this model more because not just because of the schedule, but more so because of the care that I have to provide. Unfortunately, sometimes costs a bit more than what a cash pay option would allow to be a fair value. So insurance has to step in with some of the care that I provide. Another option that is something that's new to some of the people in our audience, maybe, or maybe they've not even heard of it before, is known as direct primary care. And I like to highlight this model because this is a newer model that's being offered by primary care doctors typically, where they have more of a limited panel, and it's considered more of a membership model rather than using insurance. And why this is helpful is that this provides more of a direct relationship with your primary care doctor. One of the complaints that we've had for years, and I'm sure a lot of people have experienced this, is that when you go to, say, a primary care doctor, you may have a very limited time to spend with your medical provider. And that opportunity to speak to them about all your concerns or complaints is hindered or maybe not even offered. You kind of feel like you're rushed into having a quick visit and getting your questions answered, but maybe not to answer to the satisfaction that you were hoping for. And so with this direct primary care model, which is a bit of a different approach where the doctor has more time to spend with their patients because their panel is smaller and they're not restricted by the constraints of insurance rules. They can spend more time with the patients, and then there's a better opportunity to ask all the questions you may have. And in most cases, most of these doctors will also provide better communication options such as emailing, texting, telehealth, of course, and in-office visits. So there's a bit more opportunity to utilize other technology to get the maximum, benefit from your doctor's visits. They also are, because they have a limited panel, they can offer same day or next day appointments, which, of course, I'm sure in some of the other, insurance-based models, that's unheard of these days due to the limited availability. Because of the busyness of most of these providers in the insurance-based models. And then moving on to another option, this is kind of another upgraded version of direct primary care that's known as concierge care. This is maybe something that is a term that you may have heard of more so than the DPC model, which I just presented in the last slide. Concierge is also offered by primary care, but sometimes some specialists will also offer this level of service. Here, there are some fees that are a bit more on the higher end to become a member of a concierge clinic. Again, they have a limited panel, so they can provide a dedicated focus to their panel of patients. And again, they have the same communication options again, where they have emailing, texting, telehealth, or in-office visits. Again, same day or next day appointments are offered, just like with the DPC panel. The main difference here is that going back to the fees for a second, is that not only do the fees get charged as a membership model, but they also usually charge insurance as well. And to highlight the difference between concierge and direct primary care in the previous slide, usually the direct primary care doctors only charge the membership model fee and do not charge insurance. So it's a little bit more on the lower end as far as cost is concerned. And a lot of patients, for example, that have high deductibles or have no insurance at all, usually will go for the DPC or the direct primary care model to at least get a good primary care doctor in their corner that will help them whenever they have any medical needs. And then, of course, if there is a need for some more aggressive care, or you have the means to support some kind of higher level care, then the concierge option is available for those people. So moving on to the healthcare delivery options again, the outpatient visits, of course, the majority of what most of us will, encounter in our medical career. Typically, before a visit, there is a certain step of, rules and protocols we have to follow to make sure that the office visit goes smoothly. And of course, the big thing that we have to always start off with first is checking insurance coverage when it comes to the traditional insurance models. And this is a very complex and confusing issue these days. And typically most clinics are somewhat helpful. I know that my clinic is in trying to help navigate your insurance coverage, but sometimes they may not go through all the details. And unfortunately, it's sometimes the responsibility of the patient to call their insurance provider so they know what their expenses may be when they go see a certain medical clinic. Office forms, of course, we all, I'm sure, love office forms. And of course, I'm being a little sarcastic there. These are vital to us as medical providers. We know they're tedious. We know they take time to fill out, and there's a lot of information that is requested. And even though in this day and age of medical records that are electronic, unfortunately, a lot of clinics don't share the same medical record system. And so it does require, especially if it's a new clinic that you've never visited before, that those forms have to be filled out in complete form, or in complete, all the way through, even though it's maybe information that you feel you've already shared before, or would feel like it would be easily accessible with accessing the medical record. unfortunately, it's the communication between different medical records is not a great. And so we do need these forms to be completed so that we can give you the best care possible when you come and see us. And of course, in the office visits, we have the face-to-face encounter, which of course is the best way to take care of patients. Although we do have televisits, we still prefer, and I still prefer face-to-face encounters because we can get more detail with those visits, and we can also get a proper physical examination, which we'll go through here in a minute. But it helps us build us a better rapport with our patients. It's a bit more of a comfortable setting. Especially if somebody's not technology savvy, of course, this is even better than the telehealth options that are available. But typically the quality of care improves when it is a face-to-face encounter. And then, like I mentioned, televisits are good, but they're really better for follow-ups. And sometimes with new patient visits, if it's something that is a simple question, but usually I never say that any question is simple. I'm always identifying things that may require some further investigation, physical examination, or a lengthier discussion. And it just is an easier thing for me as a clinician. I think most of my colleagues would agree that a face-to-face encounter is the best way to get the maximum care. It's important also that we highlight continuity. Once you establish care with a doctor or a clinic, ideally the same provider is what you want to stay with, as long as you're comfortable staying with that provider. That's an important thing to highlight, that you want to have trust, of course, and it goes both ways. But continuity allows you to get the best care possible, because it's good for somebody to know your current situation, your previous exposures or previous treatments, and then of course what may need to be changed because they know your full history. And then I always like to highlight that, even since I'm a specialist, a lot of people will come and say, well, I don't need to go back to my primary because you'll help me take care of my allergies, which is true, and I will do that. But there are other medical conditions that I cannot treat as a specialist, and hypertension, diabetes, other things that more is under the realm of a primary care provider still needs to be managed by the primary care doctor. They're always the primary referee for all of your care. And yes, they may have you see a specialist, but usually they'll still want you to come back so they can piece it all together and be kind of the referee for all of these other specialists that you may be seeing, so that everything is taken care of correctly. It's not good to just see a bunch of different specialists, even though you feel like you're getting the best care. Unfortunately, we as specialists may not know what's best for you when it comes to other different specialty needs. And the primary care doctor will be able to put that all together for you and have that home base, so to speak, where you get the best care coordination with a primary care doctor who is able to know all of your specialty needs. So going specifically into primary care doctors, there are primarily medicine trained physicians, internal medicine or family medicine, if you've heard of those two specialties, is under the primary care umbrella. Pediatricians are also primary care doctors for the pediatric population. And then surgery, this is not really a primary care specialty, but they have kind of a different field of study where, of course, surgical focus is their training. And there are general surgeons, which are considered kind of the first tier of surgical training, where they can handle some of the bread and butter surgical procedures that most of us are familiar with, like appendectomies or tonsillectomy. Well, I'll take it back. Appendectomies or gallbladder removal, lymph node removals, things of that nature. I mentioned tonsillectomy. That's more of a specialty of an ear, nose, and throat surgeon, which is more of a specialist. And so there are also specialists in, of course, each of these fields that subspecialize in a certain area of the body. And then other specialties that are out there: OBGYN, ophthalmology, emergency medicine, neurology. These are just different subspecialties that may not fall under the medicine or surgical category directly. And what I'm trying to highlight here is that when you go through training, there are there's medicine specialties, there's surgical specialties, and then there's others kind of as a third tier where the training is a bit different, but still under the umbrella of medicine. So when we go back to the office visits for a second, we usually, when the doctors or the provider has never seen you before, it's considered an initial visit or a consultation visit. If it's a specialty like myself, we call it a consultation. When you go into your primary care doctor for an annual checkup or a physical, also known as a well visit or a well child visit in the pediatric realm, those are not sick visits. Those are visits where you're healthy and you're just making sure that all the internal parameters of your body that are supposed to remain healthy, like cholesterol and blood pressure and blood sugars, weight management, for adults, and then for kids, are they growing well? Are they eating well? Are they developing well? These are considered physical or well child wellness visits. And we want to differentiate those from sick visits because they are not the same. Follow-up visits, of course, that's usually a typical thing that happens after an initial visit for a consultation or a sick visit that had occurred recently with a primary care doctor or a specialist. I always like to bring up follow-up visits because a lot of patients don't like to come back for follow-up visits. They feel that, well, I'm better with the treatment that was provided on the initial visit, so why do I need to follow up? And I like to highlight this because there are things that are unfortunately subtle or unknown to the patient until a follow-up is completed to make sure that the treatment plan that was implemented is working and that there are no side effects. And sometimes the side effects are subtle. They could be affecting vital sign parameters like blood pressure or pulse or oxygen levels, which unfortunately will not be something that's known to the person that's being treated until those parameters are checked. Or there could be some signs in the blood work or physical exam that can change that, again, may be subtle until the doctor checks those signs. So if a follow-up is recommended, try to honor that because there is a reason for it. It's not purely just because they want to waste your time. There is a reason to go in because we want to make sure that our therapy that we implemented is effective and that you're not getting any side effects. And then, of course, I mentioned sick visits. Of course, these are kind of obvious to everybody that, you know, if you have a cold or infection or an allergy attack, in my case, or an asthma attack, then of course, we're going to see you as a sick visit for whatever that condition may be. So when you're in the office, you know, in the exam room, we like to, you know, check people's vital signs. We like to have the medical assistant who review the reason for the visit. We'd like to review the medications. And this is an important thing that, you know, I like to highlight is that medication lists are important, are very important because we want to make sure that we have a complete understanding of everything that the patient is taking, whether it's an over-the-counter medication or over-the-counter supplement, a pill from another doctor or a inhaler or whatever therapy from another doctor, or any homeopathic or other holistic medications that may be being offered to you. All of it is important because sometimes there's a cross-reactivity or interplay with certain medications that may interfere with a new treatment, and that can be potentially harmful. So always have a current up-to-date list of medications with you. What's even better is if you just bring in the pill bottles or the boxes with the instructions on the box in a big bag. I know it's probably sometimes funny to carry all that in, but it really does make a difference and helps us as medical professionals to make sure we know exactly what you're taking in your current day-to-day therapy. And then, of course, waiting in the exam room. We always like to address waiting because I know that's always an issue when some people are waiting for an extremely long period of time. And I like to address this by just saying that, you know, we all try to give our best effort to keep on time. Sometimes, unfortunately, even though an appointment is at a certain time, we get behind because we had to spend a little bit more time with the previous person. due to a sudden change in their physical health or an emergency that may have arisen due to a sick visit that turned a bit more that required more attention than we were initially thinking. And sometimes we can't predict these type of visits from occurring, and so we have to then spend more time accordingly. What we always recommend is, after about 15 minutes in an exam room, once you've been put into a room, if you haven't been notified of any delays, to just pop your head out of the room and ask if they haven't forgot about you, which they usually have not, but it's important to just sometimes do that, just to let us know that, hey, you're still in the room and you're waiting to be seen. And then hopefully somebody will give you a better explanation as to what's going on. It's something that I know we are all trying to strive to do better. And it all depends on scheduling, but again, the uncertainty of certain visits is what leads to some of those delays. So of course, we move on to the doctor coming into the room, or the NP or the PA. We of course will go through the reason for the visit, do a physical examination, and then consider any testing that maybe need to be done, whether it's lab testing or, in my world, allergy testing, pulmonary function testing, EKGs, urine analysis, strep tests. These all can be then decided upon. Some of them can be done on the same day. Some of them have to be rescheduled for another day. Some of them have to be done at a different facility. And that all will be, of course, coordinated with you as a patient based on the testing that is needed. And then, of course, we will make a diagnosis and a treatment plan based on our findings. And then again, I mentioned the follow-up. Of course, we're going to make sure you follow up to make sure that whatever therapy plan we do implement, or whatever procedure we plan to have done, is followed up upon, so that we can make sure that everything was done correctly and that there is a positive response to a therapy that was implemented. And again, I know I've probably hit this pretty hard about the follow-ups, but we always like to remind patients that we do need that to make sure that what we're doing is helping patients feel better. And like I said, feeling better by just those words is not enough, because unfortunately there'll be some parameters that we cannot gauge ourselves without being examined, or without looking through blood work or physical examination findings to make sure that the side effects or other complications have not occurred. And then also important to mention that sometimes in the course of the follow-up discussion, a new symptom may be discussed, or suddenly just come to the attention of the patient, which can then maybe change the course of therapy that was originally prescribed, which can then change the whole game plan. So this is also kind of where I'll reiterate the point of in-office follow-ups are nice, because sometimes then there could be some new examination that needs to be done, or new testing that may need to be done to figure out why this new symptom is developed, or if that new symptom, which was not maybe there before, has changed the diagnosis for that patient. Moving on to the responsibilities of the medical office. We of course want to provide the best medical care possible. Of course, stay on time. We do try to do our best. I know that sometimes it doesn't seem like we are, but we do keep that in mind. One of my kind of personal rules with my medical assistants is that they keep an eye on my schedule and knock on the door if I do get behind, because I do want to honor those slots and make sure that all patients are getting their time, and I'm not wasting their time when they come to my facility. Of course, we try to do our best to help basic understanding of the insurance benefits. It is a complex system, and it's not easy to navigate. A lot of people, unfortunately, are not aware of their insurance benefits because it is so complicated, or it's provided by an employer that doesn't explain all the rules of their current plan. So it's important to know what those benefits are before you go see a medical doctor. You're welcome to always call your insurance company and make sure that whatever services you're planning to seek out are covered, or if there's an expense, that you know what your expenses may be. And then we take the responsibility in most cases of filing those claims to the insurance. Not every clinic will take insurance. Those are the, like I mentioned, the direct primary care models. They may not take insurance. Not every clinic also does the option of filing the insurance. Sometimes they'll see patients that have insurance, but then we'll make the responsibility of the patient to submit the claim to the insurance. That doesn't happen often, but just wanted to give you the understanding that that may be a possibility in certain medical clinics in your area. And then, of course, we want to make sure that we communicate our findings with any of the doctors that the patient wants us to communicate with, especially if it was a referral from a primary care doctor. In my world, I always like to make sure that I communicate my findings back to the primary care doctor so that they're aware of all the therapy findings and treatment plans that I'm going to implement. And then as a patient, of course, there are responsibilities there as well. Being prepared, knowing, of course, the reason for your visit is important. Filling out the forms, as I mentioned earlier, I know it's a tedious task, but it does help us gather a significant more portion of information that will be very beneficial in making sure that you're getting the best care possible. Bring any and all relevant medical records. This is important if you're seeing a specialist, or even if you're not seeing a specialist, but you're changing doctors to a new provider that may not know your medical history. It's important to make sure that they have a complete understanding of your previous medical history and testing so that they can give you the best care possible. Medications, I'll highlight that again, bringing a current list or the actual medications themselves. And again, this includes over-the-counter supplements, vitamins, pain relievers, inhalers, holistic medications. All of it plays an important role in your health, and we need to know all of the things that you're taking so that we understand the interplay potentially of all of these therapies. We don't want you to have a side effect because of a cross-reactivity to a medication that was on your list that may have been forgotten, or maybe interaction with an over-the-counter supplement that you're taking that may be contraindicated or dangerous if you take it with a new prescription that is being offered. And then bring a list of questions. Sometimes it's hard to remember everything that you want to ask the doctor in the medical office. So writing things down before you come in is a very helpful tool to keep yourself organized, keep your thoughts organized, and know exactly what questions you have for the doctor during your visit. That helps to keep things on track, keep things on time, but also be efficient with your visit. And then this is obviously something that's self-explanatory, but being courteous. Sometimes it's frustrating to talk to a non-medical professional like an MD or a doctor's staff because they may not know have the same medical knowledge as the doctor or the nurse practitioner. And so the support staff are there as exactly what that word means, support. They're here to support the doctor or the provider during that office visit. So they have rules to follow for the doctor, whether it's forms to be filled out, medications to be listed, insurance verification to be done. So unfortunately, if there's a clinical question that arises that the patient wants an answer to, the support staff probably will not know that answer. And so we want to make sure that you understand that they're there to support the medical doctors and they're part of the team. And then, of course, we want you to be aware of your insurance coverage. I mentioned that already, where understanding your benefits is important so that you know what, if any, cost may be incurred during the visits. And then being honest. I mean, this is again another self-explanatory concern. Some people don't feel like they can completely explain all their symptoms in full honesty because they feel ashamed or shy or embarrassed by their health concerns. And know that everything that is discussed in a medical office is 100% secure from the healthcare exchange. The HIPAA, if you're familiar with HIPAA, which is the Health Information Protection Act, which helps to make sure that whatever you tell your doctor or your medical provider is private and not something that is going to be publicly disclosed. We can only provide you the best care possible if we know the full situation. And most of us, if not all of us, have seen everything under the sun. And so nothing really phases us as far as unique conditions or kind of embarrassing situations, because we've taken care of a lot of these similar patients in the past in various experiences. And so really, when it comes to the human body, really there should be no concerns about bringing up any concerns that you may have, because again, we usually have had experience in that area, or at least understand the situation that may be being discussed, so that you don't have to feel uncomfortable bringing up any of those concerns with your medical team. So kind of a lengthy discussion there. I definitely wanted to kind of just highlight all of these important kind of medical office findings here. And we hopefully, we're able to get a better understanding of how a medical office works and how it runs, and understand the roles of the office staff, understand the roles of a patient, as well as the realization that communication is always the best thing. Of course, that's in most professions, but open communication is ideal to make sure that the best care possible is being implemented for you as a patient. And now we have time for questions.
Well, thank you. I feel like we've gotten the Iron Curtain pulled back.
Yeah.
And even for those of us that are in healthcare on a daily basis, I know I learned something when just looking at your presentation before we even, as we were putting the webinar together. So we are much appreciated for all the information that you provided. Some key takeaways that I got from what you said, we could call them our feathers to remember for Accessia Health. One of those is that you are our partner in care, and that you want to help us figure out what it is that's bothering us. That healthcare is a science, and that doctors don't have all the answers, but you're curious and you want to find the answers.
Correct.
So the more information we provide to you, instead of being afraid to provide information, the better you are able to put together the pieces of the puzzle.
Absolutely. Absolutely. There's many cases where I'll be in the room, and it's hard for us sometimes because, of course, we're on a time schedule and we want to finish the day or make sure we get to the next patient so we don't get behind in our schedule, because, of course, that's an important thing that we have to try to follow. But I try to do my best as a personal kind of experience, where I just want to, when I go in the room, I'm just going to be very generic and say, tell me why you're here, and then be quiet, try to listen, because 90% of the diagnosis comes out of the history from the patient themselves. They know their body more than you know what's going on. So just listening to their story usually can give you the diagnosis in the majority of cases. But there are sometimes cases where, as I'm walking out the door, they'll be like, oh, one more thing, I forgot to mention this one thing, and then that will change the whole course of treatment, and I got to go back and sit down for a few more minutes and discuss that new issue. So listening is important, and we have to spend that time as providers to make sure that we get the best diagnosis possible. But being prepared as a patient to have all those questions ready to go will help to speed up and make sure the right diagnosis is made.
I think that is one of the most important things to remember, that we're all partners in the care, and tell you things, don't hold things back. We have 5 questions in addition to that great information. I think one of the easiest ones to ask at first is, you mentioned this, fill out your paperwork before you come to the doctor's office. If somebody is a caregiver, can they call on behalf of their mom or their the person they're giving care for and request those forms in advance so they don't have to come a half hour early?
Absolutely. Usually, it's a team effort sometimes, especially when it's an elderly person or a child that needs assistance, because not everybody's computer savvy or even has access to technology that may help fill out those forms. So yes, absolutely. Anybody that is a family member or a legal guardian is allowed to fill out those forms for their patients or for their family members. If not online or before their appointment, maybe if they come with the patient during their visit, then they can help them fill out the forms prior to the visit here in the office.
Great. Another easy one. Well, could be easy. Can NPs or PAs prescribe?
They can. Absolutely. They are allowed to prescribe. That is one of the benefits of their training, is that they are clinical professionals with the slightly difference there with nurse practitioners. They depending on the state, they can practice under the supervision of a medical doctor or without. A physician's assistant has to be 100% under the supervision of a medical doctor before they can prescribe. But that under the supervision rule is a bit lenient. Only, I believe 10% of case charts have to be reviewed by a medical doctor or doctor of osteopathy to classify that as supervision. So that's just the way the training has been set up. But yes, to answer the question, they are allowed to prescribe medications, testing, and procedures if they deem it necessary.
Great. All right, here's a whopper for you. How should I handle it when two different specialists are arguing over medications for me?
That's a great question. That's a tough one. I mean, especially if, are they the same specialists? I guess we don't maybe know the answer to that, but yeah, that's a challenge. Usually in that situation, what I try to do, of course, I try to have the two doctors communicate. You know, if it was me disagreeing with a plan from another physician, I would call that person up and understand their side of the equation, and really make a personal effort to discuss it with that provider directly. If that is not possible or they're not willing to do it, then that's the perfect instance where you need to get back to your primary care doctor to get that person involved. Because usually the primary care doctor is that referee that's going to then tease out, you know, what's going on here, why there's a discrepancy, why is this dilemma there, and then the primary care doctor hopefully is somebody you rely upon as your rock to then help you make sure that the right decision is made. It's rare for us to disagree to the point where we're not going to, you know, make sure that the right thing is being done for the patient. So I just to give you my experience, I rarely have had that type of encounter. And usually if it's a misunderstanding on the reasoning in some cases, which is where if I call that provider and say, this is why I'm giving this medication, and you were disagreeing with it, let me explain myself. And usually when that happens, everything is smoothed over and everybody's hunky-dory. So it really is all about communication again. And hopefully those two specialists can hash it out comfortably. But if they don't want to do that, then your primary care doctor is the best person to step in and have them help figure that out for you.
And I think you just illustrated a fabulous point that we all need to have primary care physicians. And I can tell you many of us do not.
Yeah.
And as women, we may say our GYN is our primary care physician.
Yeah.
And that is not the best.
Some of them do have those skills, but it's still, you know, I'm a biased physician. I'm an internist, and I know the training is different with OBGYN and internal medicine, which is a primary care specialty. And definitely family medicine, which is even, in my personal opinion, and this is probably going to raise some comments, but amongst my colleagues, I think sometimes family medicine doctors are better primary care doctors than even internists, just because of the way they train. Because family medicine trainees usually have a lot of outpatient experience. They get to go to the clinic almost every day of their training program. As internists, we spend the majority of our training in the hospital, which is not really where primary care is practiced. Those are the sickest of the sick that we see, and maybe 1.5 day a week is where and this is my personal experience, where I spent only 1.5 day a week in clinic. So my outpatient experience as a primary care doctor was only 1.5 day a week, which is limited compared to a family medicine provider, which goes every single day of the week. And so they get a lot more experience as an outpatient expert. And there's a difference there. Inpatient medicine and outpatient medicine, even though it's the same umbrella of medicine, are two different fields of practice. And they actually now, when I was in training 15 or 16 years ago, there wasn't a hospital medicine training program. And now they have one dedicated for that, because it is its own unique subset of training, that skills that are required. So yes, having a PCP again is vital to having the best health possible. And even if you're healthy and you don't have a significant amount of chronic illnesses, take advantage of your annual physical, because in most cases, most insurance companies will pay for, as a free coverage, an annual well visit or an annual physical. It's part of your insurance plan as a free service or as a covered benefit. A lot of people are unaware of that. They think they have to pay out of pocket and they don't want to spend that money. And they don't realize that it's 100% covered. And so important to have that person in your back corner.
And that is regardless whether you have a high deductible plan, an
That's
HMO
right.
or PPO. So that
That's
is
right.
really important for people to know. And I'd say
Yeah.
that's one of our biggest takeaways today is
Yeah.
if you don't have a PCP, go find one.
Yep.
Well, that's wonderful. That is a fabulous answer. And I can't tell you again how pleased we are that you've joined us today. This information was invaluable. The webinar has been recorded. It will be uploaded to our YouTube channel. We will send out the link to our social media channels. We hope you will as well. And we hope that everybody that was listening today will also share the link, because the more people that start to hear this information, the more empowered we all are to amplify our voices in order to control our care. Dr. Sikka, thank you so much for joining us today, and we will have you back to talk about asthma and allergies in depth.
Will do. Thank you again. I appreciate the time.
Thanks. Bye-bye.
Bye.